Like so many epidemics before, the loss of so many lives began with a single microscopic organism. It's human nature to seek even the smallest comfort in reason or logic for events as catastrophic as these. But a virus doesn't choose a time or place. It doesn't hate or even care. It just happened.
In Health Watch, the CDC says a drug-resistant superbug has sickened nearly 600 people across the U.S. More than 300 of those cases have been reported in New York State. The fungus is known as Candida auris, and it targets weakened immune systems. Its symptoms vary based on what part of the body is infected. The bug has also spread around the world. Over the past 5 years, cases have been reported in South America, Europe, Asia, and South Africa. Health officials blame the overuse of drugs to fight bacteria and fungi.
Candida auris, a yeast fungus, was only discovered in 2009 but has quickly spread globally. When it comes to the United States and here in our area, the Centers for Disease Control says New Jersey has 104 confirmed cases. New York has 309 confirmed and Connecticut has 1. The CDC says Candida auris is a problem because it can kill you. It can cause bloodstream infections, wound infections, and ear infections. It's often resistant to medicines. It's becoming more common and it's hard to identify. It can spread in hospitals and nursing homes through contact with affected patients and contaminated surfaces or equipment. We talked with several New Yorkers regarding their medication intake and what they think about overprescribing.
I trust my doctors.
I generally try and wait as long as possible, but if it's recommended at the end of the day, I'll go ahead.
The CDC says washing your hands is extremely important. Also making sure healthcare facilities are really cleaning because they say this can live on surfaces for weeks. The CDC says it doesn't consider healthy people to be at risk for this fungal infection. People at highest risk, they say, are those who have recently stayed in nursing homes or hospitals and have had lines and tubes going directly into their body.
Health alert this afternoon. The Centers for Disease Control warning about a drug-resistant superbug fungus that has been found at hospitals in this area. Candida auris can kill within 90 days. It targets people with weakened immune systems. An elderly man died from the fungus last year at Mount Sinai Hospital following abdominal surgery. As of February 28th, there have been 587 confirmed cases across the U.S., most of them in New York State, where there have been 309 confirmed cases. There have also been 105 confirmed cases in New Jersey.
Disease can be. This outbreak has been spreading. There are almost 300 cases already, overwhelmingly in Brooklyn. And to give you a sense of what troubling development this is, it's a huge spike. We saw only 2 cases in New York City in 2017. So we have a very serious situation on our hands. We cannot allow this dangerous disease to make a comeback here in New York City. We have to stop it now. Today, we are declaring a public health emergency effective immediately. This will mandate vaccines for people living in the affected area. Department of Health will issue violations and fines to people who remain unvaccinated.
Thank you. An announcement from Mayor de Blasio about the growing measles outbreak in Brooklyn, centered in the Orthodox Jewish community.
It follows a health department crackdown on religious schools that allow unvaccinated students to attend classes. CBS News' Jenna DeAngelis, she is live in Williamsburg with more on this story. Jenna.
Alex and Mary, a public health emergency has been declared here in Williamsburg due to the measles crisis. It is now required here to get a vaccine, or you could face a $1,000 fine. And to give some perspective, Mayor de Blasio said in 2017 there were only 2 measles cases in New York City. There are now nearly 300.
The message today for all New Yorkers is to take measles seriously.
A strong message from Mayor de Blasio declaring a public health emergency. With measles cases growing at an alarming rate and Passover around the corner, a major concern for the city is people congregating will cause the dangerous disease to spread even more.
Department of Health will issue violations and fines to people who remain unvaccinated.
Ordering mandatory vaccinations in Williamsburg is an attempt by the city to put an end to this crisis. There have been 285 confirmed cases in Brooklyn and Queens since the outbreak began in October. Most involve those in the Orthodox Jewish community.
I want to set the record straight. This vaccine is safe. This vaccine not only protects your child, but as you heard from the mayor, it protects other people's children.
On top of that order, if a Williamsburg yeshiva opens its doors to children not vaccinated against the measles, the health department warns it could result in violations or school closure.
I think people should take a vaccination.
The opinion of the rabbis over here is they should get vaccines.
In Rockland County, another area hit hard with measles cases, there is still a battle going on over what to do about failure to vaccinate.
It's happening around New York State. It's only going to spread unless we fix the problems in the system. And the problems are we have way too lax of a requirement.
There'll be school vacation. There'll be more and more families together. The last thing we want to see is more family members afflicted by this disease.
The mayor doesn't want cost to be a factor, so he says the health department will give vaccines for free. All you have to do is call 311, and he's hoping this will be the last step taken for this crisis to pass.
President Trump is once again pivoting on health care this time after surprising members of his party last week when he repeatedly promised to make it a hot-button issue ahead of the 2020 election.
The Republican Party will soon be known as the party of health care. We are going to be, the Republicans, the party of great health care. The Democrats they've let you down. They came up with Obamacare. It's terrible. We are going to have a plan that's so much better than Obamacare. Obamacare is a disaster. We're going to have a plan that is so much better than Obamacare. So the health care is going very well.
So here's what happened. The president did just say that he is going to have a plan better than Obamacare, but in a series of tweets Monday night, a tweet storm, the president walked that all back. Without providing any details, he promised Republicans are developing a, quote, really great health care plan, but he said it wouldn't be ready until after 2020.
In this edition of the Red and Blue Political Roundup, President Trump now says the GOP will be the, quote, party of great health care. The president made those comments one day after announcing a new Republican focus on the issue. Earlier this week, his Justice Department wrote a legal opinion saying the entire Affordable Care Act should be struck down. Now, that's not sitting well with lawmakers, including some from the president's own party.
I'm very disappointed and vehemently opposed to the administration seeking to invalidate the entire Affordable Care Act. This is contrary to the tradition of the Justice Department, which generally defends laws.
I just can't believe that they want to, and the Justice Department has said they're not going to enforce the law of the land. That's just unfathomable to me to think that they could say that we're not going to enforce the law that basically was passed in Congress. Well, that's your job. The judicial branch is a job to enforce the laws and policies that we pass.
Welcome to the lead. I'm Jake Tapper. We begin with the politics lead and a major retreat from President Trump after Republicans on Capitol Hill objected to his push to make health care and the repeal of Obamacare a major issue for the 2020 presidential election. President Trump had been claiming that the Republicans were developing a health care plan to replace Obamacare, and the Trump administration just joined a lawsuit to try to end Obamacare immediately, though they had no plan in place for the 20 million Americans who would immediately lose access to their health insurance. But after hearing from allies in Congress, the president is now backing off, announcing the Republicans will not hold a vote on any new health care plan until after the 2020 election.
Cunninghams' disappearance made national headlines. Police refuted social media conspiracy theories that the scientist had stolen a virus and fled.
This time last year, Tim Cunningham was missing.
Well, tonight, no one knows where Timothy Cunningham is.
A commander at the CDC, a pillar of Atlanta advocacy. his disappearance reached the world.
I walked into my nail salon and there was a picture of Tim with a missing sign, and I literally had to walk out, collect myself, and then come back in.
The coverage focused on clickbait. Commenters spread conspiracies. Lost in it all was the impact of a man entwined in his city more than most understood.
Back porch at my house.
Joe Carlos knew Tim through Morehouse.
Holding my little girl.
First as a classmate, then as a friend and alumnus who donated constantly and taught public health classes for free.
The conspiracies, that stuff, it seems so beneath him.
Growing concerns this morning after a vial containing a potentially deadly virus goes missing from a lab at the University of Texas at Galveston. Now, Dr. Mark Seagull is a member of the Fox News Medical Aid Team, Associate Professor of Medicine at NYU's Langone Medical Center. And Doc, good morning to you. What do we need to know about the possibility that this could be dangerous?
Well, Bill, in this case, this is called the guanarito virus, and it affects Venezuelan rats. Now, look, it doesn't even affect rats from the United States. So it is not going to do what I call jumping the species barrier and infect humans. It is not going to happen. It's very deadly in Venezuelan rats. It's not even making our rats sick. It is not going to jump to humans. Everybody watches this news and they think of Contagion, you know, the movie Contagion, it's going to happen that way. It's not going to happen. But, you know, Bill, at the same time that this news is out, the Government Accountability Office is about to issue a report saying that the security in our labs isn't what it should be in the United States, and that this stuff can happen.
That's interesting, too. So
out.
You know about this research facility in Galveston? Tell us about it.
Well, that research facility in Galveston is a very good lab, but the top research facilities in the United States, and I want to reassure our viewers about this, they call them level 4 biocontainment facilities. CDC has 2, and the United States Army Research Institute of Infectious Disease, U.S. AMRID, has the biggest, 10,000 square feet. People wearing space suits, researchers, the air is filtered. They very, very rarely have a problem, and they're involved in defense against bioterrorism. So they got Ebola there, they got Marburg virus there, they got flu and they're experimenting with it there, but they're doing it very, very, very carefully. They even have a facility if a person, God forbid, gets contaminated there.
So it has a great reputation,
but
here's a direct question for you, Doctor. How does a vial go missing? How is that possible?
Well, Bill, this is the problem we saw with the anthrax mailings, if you recall, in 2001. I think a vial goes missing if a scientist or a helper, an aide, you know, somehow mistakes it or it disappears or they take it. I mean, I think this needs a very serious investigation. In this case, I'm not worried about the public, but it's a wake-up call that we really got to watch at. A lot of hands are touching things, you know, and that's why that's the biggest risk. The biggest risk of bioterrorism, unfortunately, is a lab accident or a lab error.
Is that so?
Because we can defend against terrorists, but it's very hard to defend against a scientist gone AWOL or somebody that slips or an accident that occurs. This virus is not going to be the one.
And you've heard of this before, the guanarito virus?
I've heard of this virus, but again, this is one of those deadly viruses in animals that we're studying to see what the difference is. What would you have to do to this virus to get it to the point where it could affect humans? In 1918, we saw something jump the species barrier, a flu virus, but it doesn't happen that often. We need to know scientifically what it would take for it to happen. You know, that's the movie Contagion. It's very, very rare.
Mark, thank you. Really appreciate your insight.
Good to see you, Bill.
Dr. Mark Seagull, live there today from Detroit, Michigan. Thank you, Doc. 6 minutes now.